Hey there, test coming up on personality disorders. I have 21 questions for you. Ready? Let's learn Psych fast. Question 1. For a diagnosis of borderline personality disorder, a patient must have 5 or greater of several types of behaviors. Which of the following criteria is considered one of the behaviors of this disorder? Is it A, changes in mood that last for months at a time? B, extreme caution with activities that cause harm? C, heightened self-image? Or D, repeated suicidal behavior and or gestures? The answer is D. Repeated suicidal behaviors, gestures, or self-mutilation are significant criteria for diagnosing disorders, among other things. Choice A, that's not correct, as BPD is often characterized by rapid mood shifts lasting hours, not months. Choice B, that's incorrect. Impulsivity rather than cautiousness, especially activities with potential harm, aligns more closely with this disorder. And then the last one, choice C, well, patients with BPD commonly exhibit an unstable sense of self and certainly not a heightened self-image. Question 2. Both environmental and genetic factors contribute to the development of antisocial personality disorder. It is more common among first generations of patients with the disorder than among the general population. Which of the following findings is a prominent personality trait in patients with this disorder? A, insecure in relationships. B, lack remorse for actions. C, premeditative with actions. Or D, responsible financially. The answer is B. So when it comes to ASPD, patients often engage in unlawful and reckless behavior purely for their own pleasure, showing little to no remorse for their actions. Choice A misses the mark since insecurity in relationships isn't typically a trait. In fact, individuals with ASPD often exude self-confidence and may exploit or engage in non-monogamous relationships. Choice C isn't a point either, as impulsivity tends to overshadow premeditation in their actions, with consequences often overlooked. And as for choice D, it's off because financial responsibility is not their strong suit. Instead, they lean towards social and financial irresponsibility, frequently defaulting on loans, neglecting to pay bills, and failing to meet child support obligations. Question 3. A patient who was recently diagnosed with antisocial personality disorder reluctantly comes to the office to discuss treatment options. During the interview, the patient is aggressive and has a labile affect, switching moods from aggressive and arrogant to benevolent and manipulative. This type of patient with ASPD may benefit from which of the following? A, atypical antipsychotic therapy. B, cognitive behavioral therapy. C, consultation with a lawyer. Or D, contingency management. The answer is B, CBT. Long-term behavior change isn't typically associated with the treatment of ASPD, but for patients exhibiting aggression and labile affect, cognitive behavioral therapy might prove beneficial. Choice A? Well, no. While drugs like lithium could alleviate symptoms and potentially modify behavior, evidence supporting the effectiveness of atypical antipsychotic therapy for ASPD is limited. Choice C and D? Well, no. Short-term strategies such as legal consultation to understand consequences or contingency management withholding rewards until behavior improves can sometimes be suitable therapeutic approaches. Question 4. Patients with borderline PD have an intolerance of being alone, and they make frantic efforts to avoid abandonment and generate crises. About 75% of patients diagnosed with this disorder worldwide are female. In the U.S., the ratio of men to women is 1-to-1. First-degree relatives of patients with BPD are how many times more likely to have the disorder than the general population? Is it A, threefold, B, 5, C, 7, Or D, 9? The answer is B, 5. First-degree relatives of individuals with BPD are significantly more predisposed with a 5-fold increased likelihood of developing the disorder compared to the general population. So obviously that makes A, C, and D incorrect. Number 5. How many subtypes of NPD are recognized? Is it A, 2, B, 3, C, 4, or D, 5? The answer is B, 3. So check this out. Research has pinned down 3 types of narcissistic personality disorder. There's the grandiose/obvious type, the vulnerable/hypervigilant type. Sometimes that's called fragile. And then also the third, the high function type. Now, diagnosing NPD has stirred up some controversy over the years, but at its core, it's all about craving admiration, acting all grandiose, and having a bit of an empathy shortage. The grandiose, oblivious folks, well, they're all about thinking they're the hottest thing since sliced bread without a hint of remorse. They're into manipulation, anger, and chasing after power and perks. Then you've got the vulnerable, hypervigilant crowd. They might come off as super shy and are always carrying around a lot of shame and hurt. Plus, they've got this idea that they've had it tougher than anyone else. Lastly, there's the high-function crew. These folks are the trickiest to spot. They can be charming as can be, smooth talkers, and super outgoing. Question 6. The main treatment for BPD is psychotherapy, and many psychotherapeutic interventions are effective. Which of the following interventions is an integrative approach that focuses on lifelong maladaptive patterns of thinking, feeling, behaving, and coping, and tries to replace these patterns with healthier ones? Is it A, dialectic behavior therapy, B, mentalization, C, schema-focused therapy, or D, transference-focused therapy? The answer is C, schema-focused therapy. This therapy targets the formation of maladaptive schema into more constructive patterns of thinking, feeling, behavior, and coping mechanisms. Choice A, dialectical behavioral therapy, well, that involves both individual and group therapy sessions with therapists acting as behavior coaches available around the clock. Choice B, incorrect. Mentalization-based treatment assists patients in managing emotions and fostering empathetic relationships with others. And choice D is also incorrect, which was transference-focused therapy, as that facilitates healthier interpersonal connections by channeling transference dynamic towards the therapist. Question 7. Patients with histrionic personality disorder continually demand to be the center of attention. When they are not, they often develop which of the following? A, somatic symptom disorder, B, conversion disorder, C, depression, or D, narcissism? The answer is C, depression. Individuals with histrionic personality disorder consistently seek attention and may experience depression when they're not the focal point. A is incorrect. Somatic symptom disorder may also be present, prompting their evaluation. And B and D, those were incorrect. Comorbidities are frequent, including other personality disorders like antisocial, borderline, and narcissistic types. Additionally, coexistence with conversion disorder is not common. Question 8. Fact or fiction? Countertransference is less of a risk for therapists treating patients with NDP. Fact or fiction? Fiction. Listen up. When treating patients with narcissistic personality disorder, therapists gotta watch out for something called countertransference. Basically, it's when they start feeling some kind of way because of the patient's behavior. So it's a good idea for the therapist to have someone they can chat with regularly about their feelings, especially if they feel like the patient are not giving them the time of day. Question 9. Which of these often exacerbate many borderline personality disorder symptoms? A, perception of abandonment, B, perception of rejection, C, interpersonal stressors, or D, all of the above? The answer is D, all of the above. Most BPD symptoms, including psychosis, often are exacerbated by the perception of abandonment, of rejection, and other interpersonal stressors. Question 10. Individuals with which personality disorder often display excessive emotionality and attention-seeking behavior, crave excitement, and may engage in dramatic or sexually provocative behaviors? Is it A, narcissistic, B, borderline, C, antisocial, or D, histrionic? D, histrionic. Now, when someone's all about the drama, attention-seeking, and they just can't get enough excitement in their lives, well, we're likely dealing with a certain personality disorder. That's right, it's the histrionic personality disorder. Folks with these disorder crave attention like it's their lifeline, and they'll do anything to get it, even if it means being a little bit over the top or provocative. It's like they're always auditioning for the lead role in their own soap opera. Question 11. Histrionic personality disorder can be distinguished from other personality disorders based on characteristic features. For example, patients who consider themselves bad and experience emotions intensely and deeply may have which of the following personality disorders rather than histrionic? Is it A, borderline, B, dependent, C, multiple, or D, narcissistic? A, borderline. People with borderline disorder often see themselves in a negative light and feel emotions really intensely, unlike folks with histrionic personality disorder who don't usually view themselves that way. Now, patients with dependent personality disorder, they're kind of like those with histrionic personality disorder in that they want to be close to others, but they're more on the anxious and submissive side, always worried about getting rejected. Oh, and you know that thing called multiple personality disorder? They call it dissociative identity disorder now. And hey, those with narcissistic personality disorder, they also crave attention, but they're more into being admired or put on a pedestal, unlike those with histrionic personality disorder who are cool with any kind of attention. Question 12. A patient presents with a history of manipulative behavior, a pervasive pattern of attention-seeking, exaggerated emotions, and discomfort when not the center of attention. Which personality disorder is most likely? A, borderline, B, antisocial, C, histrionic, or D, narcissistic? Well, let's picture someone who's always craving the spotlight. They're a bit of a drama queen, and they just can't stand it when they're not the center of attention. Sounds familiar? Yep, that's the classic histrionic personality disorder. Folks with this disorder are like magnets for attention. They'll do whatever it takes to be the spotlight, even if it means being a little bit extra or over the top. It's like they're the star of their own show, and they'll do whatever it takes to keep the audience hooked. Question 13. General treatment of histrionic personality disorder is the same as that for all personality disorders. Which of the following is used to treat histrionic personality disorder? A, benzodiazepines, B, CBT, C, psychodynamic psychotherapy, or D, SSRIs? The answer is C, psychodynamic psychotherapy. Why? Well, A, B, and D, little is known about the efficacy of cognitive behavioral therapy or drug therapy for histrionic personality disorder. So why does psychodynamic therapy work so well with histrionic PD? Well, because it helps folks dig into why they act the way they do. By chatting about their feelings and past experiences, patients start to understand why they seek attention and validation so much. It's like shining a light on their subconscious, helping them see why they react the way they do. This therapy helps them build better coping skills and healthier relationships. Question 14. Antisocial personality disorder is diagnosed only in patients 18 years or greater. Therefore, in order to be diagnosed with this disorder, patients must meet specific criteria in addition to having evidence of which of the following associated disorders before age 15. A, ADHD, B, borderline personality disorder, C. Conduct disorder, or D. Impulse control disorder? The answer is C. Conduct disorder. So before jumping to an ASPD diagnosis, it's crucial to dive deep into the patient's history. Look for evidence of meeting several criteria, including a track record of conduct disorder before hitting the age of 15. While it's common for patients with ASPD to also exhibit disorders like those listed in choices A, B, and D, diagnosing these isn't mandatory for ASPD. Question 15. Which of the following characteristics of patients with antisocial personality disorder best differentiates them from patients with narcissistic? A. Disdain doing anything silly to get attention. B. Exploit others for material gain. C. Have mood changes that are triggered by insults. Or D. Often present with depression. The answer is B. They exploit others for material gain. Now, here's the deal. Folks with antisocial personality disorder have this trait, while those with narcissistics use people to feel good about themselves. Now, choices A, C, and D, they're all about the narcissistic PD crowd. Question 16. Which is most accurate regarding the risk for suicide in individuals with NPD? A. They are less likely than those with other personality disorders to attempt suicide because they have a high self-esteem. Or B, they are at high risk for completing SI without warning signs or disclosure. The answer is B. Okay, so here's the thing. Researchers have found that folks with narcissistic personality disorder are more likely to try to off themselves or make some serious attempt without any warning signs. Another study backed this up, saying that even though we're not exactly sure why people with NPD might feel that way and of SI, it's not always because they're depressed. Sometimes it's all about their need to keep up with that perfect image or ideal with some heavy shame. When they feel like they can't fix things, SI might seem like the only way they have out. Question 17. Although no medications are approved by the U.S. Food and Drug Administration for the treatment of narcissistic PD, which medication can help control certain manifestations? A. Chlordiazepoxide, B. Topiramate, C. Risperidone, or D. Methadone? The answer is C, risperidone. So here's the deal. Even though there aren't any medications officially approved by the FDA for treating narcissistic PD, some docs and NPs use certain meds off-label to tackle its symptoms. They might prescribe antidepressants like SSRIs or SNRIs, antipsychotics like risperidone, or mood stabilizers like lamotrigine. These meds are aimed at helping with the stuff like depression, anxiety, mood swings, brief moments of losing control with reality, and keeping impulse behavior in check. Question 18. Which of these are symptoms of borderline personality disorder? A. Auditory hallucinations, B. Dissociative symptoms, or C. A and B? The answer is A and B. So borderline personality disorder symptoms can include the following: transient stress-related disorder. Auditory hallucinations are predominantly negative and critical in tone with the presence of dissociative symptoms. Also, reduction of psychosis over a long-term course, and they also can have increased psychotic symptoms in response to interpersonal stresses. Question 19. Which of the following personality disorders is characterized by a pervasive pattern of disregard for and violation of the rights of others, as indicated by engaging in criminal behavior, deceitfulness, impulsivity, and lack of remorse? A. Histrionic, B. Narcissistic, C. Antisocial, or D. Borderline? The answer is A. Antisocial personality disorder is characterized by a consistent disregard for the rights of others and a lack of empathy. They'll often engage in criminal behavior, deceitfulness, impulsivity, and may not show remorse for their actions. This pattern typically begins in adolescence or early adulthood and persists into adulthood. Question 20. A patient presents with a history of unstable interpersonal relationships, intense fear of abandonment, identity disturbance, impulsivity, recurrent suicidal behavior, and affective instability. Which personality disorder is most likely? A. Antisocial, B. Narcissistic, C. Histrionic, or D. Borderline? All right, let's picture this. A person who's all over the place with their emotions, struggles to keep relationships steady, and feels like they're on a constant roller coaster ride with ups and downs. That has to sound familiar by now. Yep, we're talking about borderline personality disorder. Folks, borderline personality disorder often have a rocky ride when it comes to relationships. They can't stand the thought of being abandoned, and sometimes they act on their intense emotions in ways that might seem impulsive or even dangerous. It's like they're constantly walking on a tightrope between feeling okay and feeling like everything's falling apart. So that's why the answer to this question is borderline personality disorder. Question 21. Which personality disorder is characterized by grandiose sense of self-importance, a need for excess admiration, and a lack of empathy for others? Is it A, borderline, B, histrionic, C, narcissistic, or D, antisocial? Let's do imagination again. So we're going to imagine someone who always is talking about themselves. They think they're the greatest thing since sliced bread, and they can't seem to see things from anyone else's perspective. Sounds like someone you know? Yes, of course it does. That's the classic vibe of that narcissistic personality disorder folk. Folks with this disorder are all about themselves. They need constant admiration, and they just cannot seem to wrap their heads around the idea that people might have feelings too. It's like they're starring their own movie and everyone else is just an extra. So that's why the answer to this question is narcissistic personality disorder. All right, those are the 21 questions. I've included some study guides. So for those that love mnemonics, here are 4 for each of the 4 cluster B types. I have one for antisocial personality disorder. Think of the callous man. You could just review this of what it stands for. There's also one for borderline personality disorder. I raise the pain. And then histrionic personality disorder. I crave sin. And narcissistic personality disorder, a fame game. I'm sure different celebrities have popped into your mind, so I've included some examples. Those with antisocial personality disorder or suspected ones are Ted Bundy, Jeffrey Dahmer, Charles Manson, Adolf Hitler, Bernie Madoff, Saddam Hussein. Borderline personality disorder. Think of that NFL wide receiver, Brandon Marshall, is quite open about it. Some suspected Jim Carrey has BPD, but he only verbalized having depression. It's also highly suspected that Amy Winehouse and Britney Spears have it. Megan Fox is suspected having both borderline and histrionic, and even has a tattoo of Marilyn Monroe, who's also suspected of having histrionic PD. HPD might be Jessica Simpson, Kim Kardashian. It's also suggested that Kanye West has both histrionic and narcissistic. NPD, let's think maybe Mariah Carey, possibly Adolf Hitler, Joseph Stalin, Richard Nixon, Kim Jong-un. All right, that's everything. Thanks so much for studying. Good luck on your test. Oh, go ahead and click this video on other personality disorders quizzes. Thanks. Have a good one.